there, and welcome to this episode of the OncoPT Podcast. I am so excited today to have the brains and the passion behind the Breast Cancer Hub on the podcast today, Dr. Lopamudra Das Roy. So let's go ahead and welcome Lopa. Welcome so much to the OncoPT Podcast.
Thank you. Thank you so much, Elise. I feel so humbled and honored to be here with you today.
Well, I really appreciate you taking the time to speak with me today. So, for the listeners who are not familiar with you and the work that you do with the Breast Cancer Hub, can you tell us a little bit about you first?
About me, a little bit of my background. Yes, I did my PhD in genetics and molecular biology from India, and then I did my postdoctoral fellowship from Mayo Clinic College of Medicine, and that's where I totally dived into the cancer research because it was mostly with the breast and pancreatic cancer and the metastasis part. Then I also did my MBA from Northwestern Kellogg School of Management, and I was working at UNCC University of North Carolina at Charlotte as a research professor, and I have like around 22 years of experience with mentoring undergrad and PhD candidates in the field of cancer and genetics. And also at UNCC, I received grants from Department of Defense as a principal investigator, finding the targeted therapies and mostly for the link, discovering the link between arthritis and breast cancer. And also I had my grants from National Cancer Institute too. So yes, I was totally into the research field, a hardcore scientist at heart, but there were something that always bothered me growing up. Like for example, I come from a family of physicians. And I come from northeast Assam, northeast part of India. And growing up, I always heard my dad, who was late Dr. Chandrasekhar Das, who was an eminent pediatrician in northeast India. He would always speak to the mothers about breast milk, to feed their babies with breast milk. So I had no idea, that there were the certain like taboo associated with the word breast, because it's a lot of culture that we face, because we come from different ethnic cultures. And but in when I was 12-year old, one of my friend's mother, she passed away, and I went for the funeral. And over there, I saw that even to utter the word cancer, it was a big taboo. And when I kept asking like cancer where, even her friends didn't want to say it was in the breast. But I kind of figured it out. I was always a curious child, and then when I repeated breast cancer, they're like, shh, I'm not supposed to talk about it. This really left an impact on me because I felt that this is the respect we are giving to a mother. We cannot discuss the disease that cost her life. And then and this was a shock because at home and on our dining table, my grandfather was a physician. They would always discuss everything. So beyond the boundaries of my house, there existed this taboo, and that probably affected me the most. And coming from India at that point, every now like whenever the word cancer or cancer was detected in a household, it was a death sentence because it was always detected late. So I really wanted to do something in the scenario of cancer, but not specifically breast cancer at that time. But eventually, my research, everything, like even the genetics and the molecular biology research was also implicated towards DNA damage and cancer. And then when I did my postdoc, had my grants, everything was, as a research professor, was more thoroughly in depth with the breast and pancreatic cancer. But then, like I would still go for the conferences and I would meet oncologists from the developing world who would tell me how women are still detected late because they do not want to discuss any issues in the breast. So this really bothered me because here in the lab, making these discoveries which are very essential, I understand, but we were forgetting something very fundamental. That means just expressing something going wrong in the breast, that challenge was huge in the developing world. And that's why the death rate was significantly higher. And that was the reason in 2017, though I was at the prime of my career, having all this on my plate, but I felt that if I think about my professional career, I can never do something that I really believed will make a change. And that's when I resigned in 2017 and started Breast Cancer Hub as a full-time pro bono humanitarian work. So everything I do is 100% free, and this is to bridge the gap between the developed and developing world. And I started this volunteer-driven organization.
Man, I'm so blown away just by what an extensive career you've had, and you made such a change after so many years of being in the research side of things and instructing and teaching this to then really this very patient community member centered organization. But before we jump into the breast cancer hub, which is obviously the main reason I brought you on here, it really struck me, Lopa, that I was working with a patient yesterday.
Mhm.
She's, I think, a year post her diagnosis. She's done with breast cancer treatment. But even here in Texas, which is a
Yes,
developed
developed.
country,
Yes,
right? You
absolutely.
know, even in a developed area that I'm in and it's fairly metropolitan, she still even commented on sometimes the shame and embarrassment that she felt, not because she had breast cancer, but because of sometimes how others would react to her
Mhm.
breast cancer diagnosis. And it's just so interesting. And I think it highlights how much of a problem this still is in the United States, but particularly even more so in other areas that don't have the same cultural experiences and whatnot that like this is my background, this is where we come from. So I'm curious, you made the comment that you felt like you weren't really making as big of a difference, as big of an impact as you knew you could.
Mhm.
You know, I'm thinking you're doing this research, you're a geneticist. Like you are literally the pinnacle of this research that is so life-saving. What was there like a moment where you said, I can't make the impact I want to anymore in this role? Or was it kind of an ongoing thing? What led you to eventually starting the breast cancer hub?
It's it's a great question, actually, Elise. And even if you even my family still is in shock, to tell you the truth. because because when I took this decision, of course it was a sudden decision I had to take, but it was an ongoing process.
Hmm.
Because as you mentioned, right, in the US too, so I am a scientist reviewer. I worked as a scientist reviewer for the DoD for the research proposals for many
Yeah.
years, and I would go for the study section. That was before 2017, and I would
Okay.
meet patients, who are like, I went as a scientist reviewer, but they would come as advocate reviewers, how they feel. So
Yeah.
they were reviewers, and when I would talk to them, they would tell me how even in the US they did their mammogram, but the mammogram missed their cancers because of dense breast. So, and then I would again go back next year for the study section, and they were gone. We lost them. So
Oh
it
my
was
God.
not only so what I felt, and here in the lab, I was actually working with a lot of dense breast issues, and, with the
Hmm.
molecular level, and trying to understand different pathways. But then I still really felt that how much do these women actually understand that, even when they're going for mammogram, they're so relieved, but who is telling them that, a mammogram may also miss cancer? So it
Hmm.
was not
Hmm.
just one incident that shook me. It was like a series of evidences, which made me feel
Hmm.
that, okay, in the lab I'm doing all of that, but can someone actually go to the community, translate the information, which is so vital, because early
Yes.
detection is the key, but in a very scientific way. The problem is that awareness to be done to convince others needs facts and data, Elise, and that can be
Hmm.
done through science. So I wanted to build something that would make me convince the world that whatever I'm saying is actually being executed by the women and the
Hmm.
men and the LGBTQ plus.
Hmm.
Because, no one was thinking about the men. Everyone is thinking about pink everywhere in the month of October. So that is another reason I felt that I would meet men, I would feel for them. I'm very much into the LGBTQ plus community, and I know
Mm-hmm.
what they're going through. The trans women, the trans men, especially the trans women, they, male breast cancer is very less in the rare, but trans women, they are going through hormonal changes. So it's just
Mm-hmm.
that everything kind of connected. And I would say that, what was the aha moment was, I was doing my MBA from Kellogg School of Management, as I said, and this was in 2017 June. I was doing executive MBA, so I was having my full-time job, and I would go on the weekend to Chicago to do the classes.
Mm-hmm.
And over there, one of the professors asked the cohort, "What is your dream project?" to everyone. And I said, I really want to make this change because I feel that providing simple, sustainable solutions is the key. And we have to work at the grassroots. And I got overwhelming response, from the cohort. And it was like I got that strength, I would say. So I came back to
Yeah.
Charlotte where I stay. I made up, like, I told my husband that I really want to do this. And he's like, of course, you're having a good job and you can start a nonprofit. But at least it never happens because having two
Yeah.
small kids in the house and balancing research, writing grants. So that's when I felt, I would say it was just, I don't know what strength from where I got that. I would say it was a calling. And I just thought that, okay, I just wrote the resignation letter, sent it to, to the department, and everyone was shocked. So
Yeah.
that's how it happened.
It gives me such goosebumps of you'd felt this dissonance between what I'm doing is good work and it was great work, right? Like it is
Yes,
actively helping us,
absolutely. Yes.
advance the science of cancer, but you knew you're like this is not enough for me. And oh, I just got chills, Lofa, when you were talking about that. That is so cool. And so what then culminated is you founded the Breast Cancer Hub. So can you tell us what it is and when officially you started it?
Yeah. So we registered it in North Carolina in 2017
Mm-hmm.
September, and but
Mm-hmm.
officially I would say I launched it in October 2017, and
Mm-hmm.
I so that's how it started. But when I started it, my goal was honestly to do community outreaches, go to the people, give them the information, but I wanted to provide them with some solution, not just
Mm-hmm.
because I knew that it was like, if I'm thinking of, I started with India, I started with US parallelly. In the US, what I was trying to do was more talking about the gaps that I see within the community and also within
Uh-huh.
the immigrant families from all different cultures.
Yeah.
So those
Yeah.
were my focus, and then like especially the dense breast scenario, male breast cancer, those
Mm-hmm.
are never covered in many areas. In
Mm-hmm.
India, what I did was I started to do community outreaches, collaborate with other organizations, and then, but I knew something needs to be done, and because of which I the solution, right? So I spoke to so I went through science. Honestly, I did a
Yeah.
survey. In the survey, it was all with the educated sector before I jumped in, like what I needed to do, who would be my
Yeah.
target audience. The educated sector within the developed versus developing world. I saw a huge gap because even like many of my friends said, "Oh, Lopa, you just have to go to the villages. We don't need it. We are aware about it." So I said, okay, take the survey. Do you actually
Mm-hmm.
go for screening, which means when you do not have any symptoms, you are actually doing the examination after
Mm-hmm.
40, or do you do breast self examination? Do you go for clinical breast exam? The response I got was, you know, significantly uh, lower, because after the age of 40, even the
Oh.
educated sectors in the developing world, it was only 5%. And that
Mm-hmm.
also only because 1% went for screening, rest 4% because they have concerns in the breast. Hardly anyone would do the breast self exam. When I talked to them, like, do you go for clinical breast exam? I spoke to the gynecologist in the developing world. This was their
Mm-hmm.
response. Patients, when they come to them for reproductive organ problems, if you do the clinical exam, they are like, why are you touching my breast? I did not come for problems in the breast. So it is our culture. So
Mm-hmm.
what I felt was, okay, I cannot fight culture in one day, but I cannot complain. So I
Yes.
have to provide a solution. So that's when, in collaboration with Sarah Cannon Cancer Institute and other male breast cancer organizations, we developed the breast self exam card for the first time for her and him.
Oh my
And
God.
yes, and just a one step card, and all the pictures are made from scratch by carbon, by the carbon illustration.
Uh-huh.
Then my goal was, okay, I'm going to give it to the community. But then the next question, Elise, you may ask, I'm talking about underprivileged sectors plus the community where its English is not that common. So how
Mm-hmm.
do I pass this information out? So then
Mm-hmm.
I reached out to our volunteers network, said, at that time I was just starting, right? I hardly had any volunteers, but I reached out to my friends network, community network, that, I need translation done in different Indian languages and in
Yes.
the US in Spanish, Middle
Right.
Eastern in Arabic, Urdu, Farsi, all
Mm-hmm.
these languages. You cannot believe, and no Google translation. Now, at this moment, we have this in 24 languages. Even,
No.
yes, even in
Oh my
like
God.
Chinese, Japanese, all done either by my students or volunteers, BCH volunteers from scratch. But then when I started to go ahead, I go to the community, penetrate in the urban sectors, rural sectors in
Mm-hmm.
US, India, then COVID came in, so globally doing the webinars. But just community outreach was not enough, Alice, because taking
Mm-hmm.
accountability is equally important.
Yeah.
And that's where I felt that we differentiate too. Everyone has my WhatsApp number, trust me. Like, I'll get phone calls from the different places in the world, that you came, I heard your webinar, or everyone gets my email address in the educated sector. So
Mm-hmm.
any issues, they can reach out to me, and that's when I'll give the next step guidance. And that's
Mm-hmm.
where I realized the need of the support group. So
Yeah.
then I developed this very private, so only 5% of our work is put on the website or published in social media. Rest
Mm-hmm.
95%, everything I try to do in a very silent way, because it's the patient privacy, and also what I feel from my heart, I'd want to do that, help others. So
Yeah.
basically this support group became so strong now. It's a very private WhatsApp group, and we have oncologists, we have physicians from different areas, and we also have survivors, but we have patients from the developing world plus in the US. And so basically we all come together. It's not only the medical guidance, but it's the emotional
Mm-hmm.
strength we provide,
Yeah.
and the caregivers too. Everyone forget about the caregivers, right? Because
Yeah.
they're equally going through
Yeah.
the emotions. So we developed webinars for them. We have caregivers in the group. And that's when the next step started was, everything, nothing with breast cancer hub is planned, Elise, because everything is based on the need of the community. So what I
Mm-hmm.
was trying
Mm-hmm.
to do was, as I was trying to do this community outreaches in the remote areas, and this is one of the instances in India in July 2019. So COVID didn't kick in yet. So I
Okay.
did this community outreach in a very remote village. And after my outreach, one of the girls started to cry, 18-year-old. And she said, "Why didn't you come to my village last year? My mother just died." Because she did
Oh.
not want to tell anyone about her lump, and she did not know it was breast cancer.
Oh
So
my God.
it was an impulsive decision, I would say. I told her, I could not save your mom, but no other moms will die from this village. And that's how I
Mm-hmm.
started the village adoption, which was more like, going door to door, I built the team from the villages itself.
Yeah.
And I trained them in the local hospital. So our village adoption is not just, doing seminars or sessions. It's
Mm-hmm.
going door to door. And that's when we diversified in different cancers, because when we were going and talking about breast examination, they were complaining about cervical cancer symptoms, about
Yeah.
oral cancer symptoms, because tobacco is huge in the different places, and cervical
Mm-hmm.
cancer is so big because of the hygienic conditions in the villages. So I couldn't just turn my head, and that's I'm like, okay, I wish I knew all of this, and I wouldn't have kept it as breast cancer hub, but as cancer hub, the organization name. And that's when the village, and the only compensation who gets a lease are the villagers who are the team, because I pick the I pick the people in the villages who need the financial help because they themselves are below poverty line. So those
Mm-hmm.
girls or the women who are sustaining their family with this little compensation, some are completing their education, and that compensation may be just
Mm-hmm.
$100, $150, but that is helping them to sustain, right?
Right.
So, and it is like,
Right.
so those groups, they will bring. So what happened was, when I start kicked off the villages adoption, from one village, now we have 18 to 19 villages adopted since 2020 February.
Oh
But
my
then
God.
I went to India back in 2020 February to, I went for my dad. He passed away, so he was in coma. But once I lost him, I was like, that was my dad's dream too. So I went to the field. I started or kicked off the project with one village, with two villages. But then came back to US, and that day the lockdown started. But then, since
Yeah.
we started our teamwork with those village team, they started to go to door with the mask and everything and all of that. But then we realized that they had no food because of lockdown. So we started to
Mm-hmm.
do the full food relief then, because it was more like a holistic approach. Then they
Yeah.
would tell us that we don't want to go to the hospital because we our daily wage is just $1 or $2. How are
Mm-hmm.
they going to go in this lockdown, because it's expensive, the you know with
Right.
the lockdown things changed. So then we took the responsibility. Every 15 days, even now, we have all different cancer suspicious cases. We take them to the hospital, and the villagers tell us that we do not have anyone to accompany them, because if two people are not going for their daily wage, they will not be able to eat food. So our team
Yeah.
takes them to the hospital, stays there the whole day, brings them home, follows them up, buys the initial medications. Only compensation, like the government aid, comes in when it's confirmed with the diagnosis. So we take them to the
Okay.
hospitals who serve the underprivileged, but there are many expenses that we have to cover, and that's how we take care end to end. Like, and then from one village, now 18 to 19 villages, we spread out in other parts of India. Then we started also in Africa. In Africa, we started to help, like we collaborate with another organization in Sierra Leone and other parts of Africa.
Mm-hmm.
So I do a diligent follow up of the patients we are helping with the treatment aid by actually analyzing their reports, and we know that the aid is actually going. So these are the
Mm-hmm.
ways in Africa, India, and other developing countries we are helping the patients in utmost need. So that is through the village adoption. Support groups started in parallel. Now locally, the support groups in person also started in different countries. But then another important thing, that's when, I realized, is the research that we are doing now is also at the grassroots, because now I haven't stopped my
Mm-hmm.
research. So our research is IRB USA approved, and IC ethics committee India and Africa is in the process. But the
Uh-huh.
research is more like retrospective. I'm
Yeah.
trying to do the epidemiology research study. I'm trying to do the clinical data analysis to actually understand and give the data to the nation, that why are these people detected late. With male
Right.
breast cancer, we are going to publish a paper soon. We collaborated with other male breast cancer organizations. And with male breast cancer, we saw that mostly the tumors were slow growing, but they were detected late, because of which most of the
Yeah.
men are in advanced stage. So we are now trying to work with changing the healthcare policies. So
Yeah.
that's what my goal is now in the US, in the developing world, that how through, like, what are the different policy changes that we have to make. So it's more thinking in the long run. Like for example, simple thing, Elise, one man told me he went to the he had felt a lump, had to go for mammogram in the hospital, and he was given a pink gown to wear. So just small simple thing, you know what I'm talking about, right? So because,
Yeah.
so these are like, but of course in the science part also we are trying to work in that area. But then we also, like, that was another thing that developed eventually, was I had this dream of providing, like, we were doing so much for the patients in the developing world, because with our little aid also it is helping to survive. But in the US, I wanted to make a prototype pillow, like post surgery, post lumpectomy or mastectomy, like with a pocket, so that we can put the ice pack or the heat pad, after the
Yes.
surgery, and we can just keep it like this. We also wanted to make this kind of chemo port seat bed pillows, like when we have the port, it really, there's a lot of pain here, so we have to wear the seat belt,
Mm-hmm.
and we can give this cushioning, and also very soft, chemo head pillows, sorry, chemo heads, so that it's a very soft material. And also the knitted ones, because many patients said they love the knitted ones, but so all this,
Oh,
yeah, it was a a request from our patients in the
yeah.
US. So but I had no revenue for all of this, because with Breast Cancer Hub, 100% donations we receive is going for the cause, especially for the
Mm-hmm.
underprivileged. But beautiful, kind angelic souls reached out to me last year in 2022,
Oh.
and they said, they're elderly women, and they told me they want to stitch for our patients. So they were providing, I was providing little of the raw materials, mostly they were providing all
Mm-hmm.
the raw materials. And that's how all of these beautiful products came up, and we have developed the care package. And all our BCH patients in the US, I ship them, whenever they are in need. So this is another part that kind of like evolved in the process,
Mm-hmm.
which was one of my dream projects. So yes, in this way there are different programs that I'm running with Breast Cancer Hub, and
Mm-hmm.
of course the leadership programs, because the torchbearers are the youth. So if you go to the BCH website, you will find that I do the mentorship program once, like many times, like for like 3 hours, because I kind of want to inculcate the art of thought leadership in the
Mm-hmm.
community, in the youth, so that they can take the message forward within their network of family and friends. And also, it kind of shapes their career, because they need volunteer hours, they need it for the college application, but in a
Mm-hmm.
meaningful way, because I want them to
Yes.
learn to give back to the community, and not just work for volunteer hours, but for work for the cause. And they can spread the word in the community, in the network. So they are my torch bearers, so that's how, like, I'm trying to cultivate the future generation too, so that after me, they can take it forward.
I'm blown away by all of the different things that you're doing, Lopa, but all of them, because I think it's really easy, especially when you have a serving heart, as you do, to get like overcommitted to things. All of it ties back to the very first thing that you said to me about the Breast Cancer Hub, which is sustainable, simple ways to impact the community. And I'm really, really in awe of, like, especially that last part, the getting the young people involved, because they're the ones who are going to take it forward and really help to implement this. And I think I truly believe this is a big thing that I believe as well, is that the young people are the ones who are actually going to take this information and then run with it, right? Like,
Yes.
we're going to pass on this info, and then our time is going to come, right? And our
Mhm.
impact that we have during our lifetime will finish. But if we can lay that legacy and that foundation for others to build upon that, to continue serving the community, that's where we're really going to see change, long lasting change. And so I love hearing about that, young people. I want to come back to kind of the earlier things that you said when you were talking about the different initiatives the Breast Cancer Hub is involved in. One of the things that I see in my area is that there are well meaning individuals, right, who have a passion, who have a heart for working with, let's say, the oncology patient population. But what happens is they have an idea and they try to then force the patients and the community into their like square box of a solution. And it seems like Breast Cancer Hub is doing exactly the opposite. You are listening to what the community is telling you. Hey, we need this. And then you meet them where they're at, and in doing so, you're then able to, like, that people need the education on, like, how to do a self breast exam,
Mhm.
right? We started with that. But by listening to them and serving and addressing the other needs that they are coming to you with, you are then able to establish the credibility, the trust that is sometimes not there in certain communities, and then able to bring in, this is what you need to know about breast cancer or whatever cancer you're talking about, right? Here's how to do a self breast exam. Here's what you need to know about, treatment or getting a diagnosis and whatever. And that's so underutilized I think in a lot of areas today, particularly oncology, is we have an idea of the solution because we're the scientists, right? We're the healthcare professionals. We know how things should be done without actually listening to what the patients, the communities are saying. We have a problem with this. We can't even get to this point because of this problem over here. And I just want to make sure and commend you on that because it's so
Thank you.
important.
Thank you so much. That means a lot. Yes. Ours, everything is community driven um, because as I said, right, I was on the other side that you're talking about. And in the lab, when I'm doing all of this, and it's very important. Otherwise, we can't do the
Of
treatment in the
course.
future.
Of
But
course.
listening to the community is equally important. And everything that BCH is building one after another, the programs is based on the need and is improvised. So nothing is done. I always listen to everyone. You know what? But I make my own decision, final decision, but based
Mm-hmm.
on the requirement which I feel is really genuine. Like for example, Elise, like I did all these interviews, or I request for the stories of the patients, who are willing to become advocates in local languages. So if you go to
Yeah.
the website because our advocates are our heroes, and under the heroes
Mm-hmm.
section, you will find in local languages, because a lot of times patients, like the children of the, like they have their parents in the developing world, they would tell me their mother doesn't want to do the treatment because her neighbors are telling her, you are already old, what's the point of doing the treatment?
Oh,
And
yeah.
then I will send this video in the same local language that the mother will understand, of
Yeah.
someone who is in her 60s or 70s, telling me that I'm cured, I have a new life now, and whatever I couldn't do when before I had cancer, because I was a mother at that time, a wife at that time, I crushed
Yeah.
all my passion and I wanted to dance, and I'm learning dance now. So it changes the pathway, it's a different feeling. And when I sent that video, that mom who never wanted to go for this because she was listening to the society, that one advocate story changes her life. So these
Totally.
are the different things that, and ours is a hub of resources too. I do
Mm-hmm.
internship with the students because I'm making the students come out of the bubble, work in research papers which are very difficult ones, but produce very readable in layman terms papers which are
Mm-hmm.
published on the website, so that our community, our patient, the patient family, they will never understand the signaling pathway. For example, whatever the c-kit receptor is doing
Right.
to the the breast cancer cell lines.
Yeah.
So but in simple word, like inflammation can trigger the progression. So
Mm-hmm.
that those are the ways I'm trying to build the papers too, so that but make the students, supervise them, mentor them, and breach the gap that I can see. And I
Yeah.
invite everyone, at least, like for example, our physicians, our healthcare providers, nurse, like physical therapists, you are also welcome. Everyone can join BCH family, and whatever
Mm-hmm.
way you can help our patients, it's your call. So that's
Yeah.
how we I think that I'll tell you one thing, that I had everything in life, right? High impact publications that everyone wants, this all this bombastic things, but and I was of course very proud and happy about it.
Yeah.
But now what I have is satisfaction, and I feel this is my biggest success, because we are able to save the lives of those women, men, and LGBTQ plus in the untapped conservative sectors, who would have
Yeah.
totally gone undiagnosed, or who would
Yeah.
have never even known that they had cancer. And our tagline is break the breast taboo, because that is a bold tagline that I started, because even in the most conservative areas where I'm going and preaching that, a lot of resistance initially, but then when I
Yeah.
say that men get breast cancer too, at that time the men will start to at least break that shield, and step up for their family too. So yeah,
Yeah.
it's a challenge, but I think I don't know. So it's a different feeling, at least, that we get over here at BCH, at Breast Cancer Hub.
Yeah. And one of the things, and I'm going to tie this all in. So I had a family member pass not that long ago, actually after struggling with mental health for a long time. And one of the things that was discussed in the funeral and the aftermath of the funeral is like how many individuals, once they knew that this family member was struggling, were like, you know, I've struggled with that also. Like I want help with that. And I think even the act of so radically talking about these hard conversations, right, Lopa? Like nobody likes to talk about cancer. I mean, you and
Yes.
I are a bit of an anomaly because, you know, we're in
Hmm.
this field, whatever. But nobody likes to talk about that. Nobody likes to talk about getting sick and dying and dealing with mortality. And so in a lot of situations we tend to kind of shrink away from that, especially like you said in these more conservative areas. That's a big issue, and I think it keeps a lot of people from getting the help that they need, screening, you know,
Hmm.
a timely diagnosis, starting treatment, etc. But even if you're just reaching one person, even if we just touch one person
Yeah.
who maybe is at risk and would not otherwise seek out help, who knows what kind of a generational impact that is having on their immediate family, but
Yes.
also within their community. And that cannot be like, that needs to be like plastered on billboards and shouted from the rooftops, because that is so important and it's not talked about enough. The impact that you can have on one person is not just on that one person, right?
Yes, yes, absolutely, and that's why I always say that we save a life, we save a family, and you know, like
Yes.
that is another slogan that we have, and you know, like the most when I said sustainable, Elise, it's more like for the because I work with people who have no access to hospitals, you know, like inaccessibility to healthcare facilities, then proper diagnosis and treatment management. Because every day I receive you know, what do I say? Like all these reports, I'll analyze, I'll talk to the patient family, because many times, even with the healthcare system, patients are given options. Like, you know, you
Uh-huh.
have, do you want to do lumpectomy or you want to go for mastectomy? These are the different things. We
Right.
are preferring this. So they are totally taken aback, you know, like, first of all, the diagnosis itself. The next point is that we are given an option, you know, whether you want to take the medication, the injection for osteoporosis, it's up to you. So what do we do? So that's when, you know, like my most of my time actually goes with talking to the patients or patient family, analyzing their
Yeah.
reports and telling them, okay, this pathway may be good for you. And
Right.
that's when the trust, as you said, right, the trust, I think what we run on is trust, ethics, integrity, and transparency.
Yeah.
Because Alice, you know, now on LinkedIn, for example, there are so many pharmaceuticals who will reach out because they see that I have adopted villages and all of that. Or, you know, there are different companies will email me and they will say they have products if I want to use it in the villages, because there can be trials, there can be, it's an easy access for them, and they
Right.
will provide with thousands and like 100,000, 200, $300,000 to me, and that I can
Mm-hmm.
really flourish with breast cancer hub, you know, provide such help. But do you think I'll take that? I always stood by my ethics, you know. I said, no,
Mm-hmm.
no one goes in those areas, because it
Right.
was not easy for me to build the trust in the villagers. It took me
Right.
time,
Yeah.
because initially when they were like, who are these people? Are they like other organizations who just want to take advantage of us? So, you know, like that's when, now when I go to these villages, people come running to give me a hug, you know, and nothing can be more
Oh.
rewarding. Even in the COVID times, I was there in the villages and there were
Yeah.
no masks, nothing. They just saw and they came. And it took time to build, and I owe it to my teams in India, you know, in the
Yeah.
different countries, because even in the US also, it's all like beautiful team members I have who know, who are maintaining, who are doing their due diligence to
Mm-hmm.
make that impact that is our dream, right? So
Yeah.
that's I think is so important, the trust in science, the trust in an
Mm-hmm.
organization, especially when it's in the medical field. It's so critical and important. Even if we are generating, I mean, we, our revenue, if everything is posted on our website, the audit, everything is like we always make sure that we post it all. So it's not
Mm-hmm.
huge, right? But it's not
Right.
about how much we have generated as a revenue, but it's more about how much, like, we know that all these are going for the cause, and it's coming
Mm-hmm.
from the from in a very not it's all because of the trust that we have earned even within our US community who are coming forward to donate to us. So
Hmm.
I think that that's the beauty of our organization, and that's how we differentiate. Because many times a lot of people ask me, like, that how do you differentiate, and I always say, why do we have to differentiate? It's a fight for cancer. Can't we all just come
Hmm.
together? And that's another, our tagline is together we save lives. And that's why we work together, and it's all for the community, all for the lives we are saving.
I think a major lesson to take away from what you're doing in Breast Cancer Hub and what we see other successful organizations is like we have to build that trust first before we can really form a relationship, before we can really start to make positive change. And I think, as a healthcare professional, as a physical therapist, that it's almost like a, well, of course, duh. But I think we forget that a lot of times. One of the things that I was actually speaking with my patient yesterday about was, she made the comment that there was so much that she felt she didn't learn until after she was finishing treatment, after she finished treatment, that she had questions on, and felt very much like, I feel like I would have benefited from this information previously, right? And I think a lot of this stems from, we in the oncology field, we deal with cancer all the time, right? This is not our first rodeo. We've seen hundreds if not thousands of patients who have been diagnosed with cancer. And so for us, like, cancer, we see it all the time. I know pretty typical regimens for a person diagnosed with a particular type of breast cancer. I know typical side effects, etc. But I think we sometimes forget, while this may be our 10th, 100th, 1000th patient with breast cancer, prostate cancer, whatever, this is their one, ideally, this is our one experience with cancer.
Yes,
And it's so critical that we meet the person where they're at, we establish that trust, and we build that bridge, we build that relationship so that we can serve them where, like, what they need, where they need it, when they need it, if we're
correct.
really going to make this big difference. And one of the things I meant to bring it up earlier, Lopa, and I totally like got sidetracked. One of the things that I really appreciate that Breast Cancer Hub is doing is, you are, again, at the community level, very grassroots, right? But also the research that you're doing, and I know you can like kind of see my hands in the screen here. It's both a bottom up and a top down approach to changing things. And Lope, I'm obsessed with that. Like, oh, I literally had this conversation the other day, and it just makes me so excited that we're talking about it today.
No, that you are very spot on, actually. Like, I'm telling you, I feel that with if I did not have that background, I wouldn't have
Mm-hmm.
pulled it off like this.
Yep.
Otherwise, it would have been just an awareness basis, like where we are, like,
Yeah.
it's because like, even like I do sessions for other breast cancer patients from other organizations too,
Yeah.
for example, about the inflammation that I was talking about, right? And so that's how I can connect with other groups. And as I said, right, I mean, yes, the research, because of the research, as you showed beautifully, I can now, it's more like connecting STEM to the community.
Yeah.
So it's like STEM in, so I don't think we ever had this connection before, right? STEM to
Yeah.
community. So
Yeah.
so many times I know, like, I have seen many students, they told me, like, you are connecting STEM to community. I mean, the many other groups who are inviting me for speaking about different aspects, and I'm like, yes, you are right. You captured it correct, and you said in
Uh,
a very beautiful way that yes, without research, I don't think without my background on this, and probably, and I always feel, Elise, that any organization, if they're wanting to build something, then they have to have that expertise. Because if you are thinking of starting an organization, it shouldn't be by what others are advising, because you have to make that decision at the right time, what is actually going to make a change or help with an
Mm-hmm.
impact, right? So that
Mm-hmm.
is equally important, and that's what I would say. Probably it's God's grace and blessing that I, I could have worked into any other type of cancers, but eventually I got into the postdoc with breast cancer, and then I started this, which again ties me back to my childhood experience. So I feel like everything was connected and probably destined,
Oh,
right? I mean, you never know how things, like now when I look back. And Elise, I wanted to also express that from my personal standpoint, I had 7 miscarriages, and I have two
mm-hmm.
beautiful miracle boys now. But during my extreme research point, like when I first conceived in 2000 2004, yes, 2002 I got married, 2004 I conceived. I was working as a lecturer of genetics in a college in
Mm-hmm.
India. I resigned from my job, Alice, because I knew I had, I was like, family is everything for me. I'm just
Mm-hmm.
resigning. I quit. And then when I went for my ultrasound, the doctors told me I already miscarried. So that was a learning
Oh,
lesson for me. That was my
yeah.
first time, and then I realized that I gave up so instantly something that actually, like, you know I don't know how to express. If I actually carried my pregnancy, I would have never done completed my PhD or went
Yeah.
ahead with my career. So that happened, and I was devastated at that time. But I took it with me that, work is worship for me, and work saved me each time, because every time I was miscarrying, I was getting more and more involved in the labs. I would be at work all the time, because that was my,
Yeah.
became my worship. So that's
Mm-hmm.
why even when I conceived miraculously, I went back to work in 4 weeks because I had my grant from Department of Defense. I
Uh-huh.
wanted to respect that. And also I went to work one day before my C-section was scheduled. So, so I always say that, God has his own ways. And then when I took the decision to resign, I would never, and the patience that it needs to build this organization, and the challenges and the hurdles I face, but I try to evolve and come out, is probably I gained all of this because of the experience in the personal front that I had.
Yeah.
And otherwise I would have never been able to do breast cancer hub or resign within a blink, not thinking of the financial situation that I'm going to face. Because for me, at that point, when I was going through all of that, nothing mattered. I was just doing my work, and I was feeling that, in life, losing one after another. So I wanted to save and do it in a, so I think everything, if everything changed me and evolved me as a person
Yeah.
that you see now or doing as breast cancer hub, was because of many hardships that I went through. That was also a learning lesson for me,
Yeah.
and maybe God had his reason, because I went back to work with a boom. I have to, you know and then I'm like, what did I do? And God knew that otherwise I would have never gone. And because that's how I am. I'm a very family
Yeah.
oriented person too. I mean, for me, my relaxation is at home having tea and be with my family. My pet,
Mm-hmm.
I'm still like that kind of person. So
Yeah. What do you envision? And I know this is kind of a hard question to answer because you said you let the community and the patients tell you what they need and then you decide where to go. What do you envision is coming up in the next few
mhm.
years for the breast cancer hub?
Great question. So, as I said, I go by the community needs, but
Yeah.
also I start the program, um, kind of, which is my vision. Like I knew in my heart that when I'm doing the community outreaches, providing simple solutions, taking accountability, those were my decisions that I made to
Mm-hmm.
run the programs in certain ways. And then the need of the community and to respond according to that adds up. So
Yeah.
in the long run, Elise, what I see is doing lot of work in the LGBTQ plus community to convince them with the research part, because it's very difficult for the transgender community to have them contribute towards my vision. What I feel is so important for the world to know what they're going through emotionally and physically because of all the
Yes.
all the hormones they're taking. So that is one area I really want to expand on, so that I can help this patient, help this communities, and
Hmm.
also the acceptance, because they do not want to go for screening because they've told me that they are being judged. So those are
Yes.
the areas I want to really provide my assistance. Then also, like, adopt more and more villages. But in the US, I really want to get, because I know there are so many ways the patients need help in the US too. So
Hmm.
how I can really, I don't, how can we can expand the horizon in
Hmm.
the US. That is also my another pathway that I want to take. Like, basically, like, even our patients from different communities, not just the immigrant minority communities or certain specific ethnicity, like, to
Hmm.
because I know why we can help. I know there are so many ways that we are helping our other patients who are getting benefited, but really want to do more. And of course, in the Africa, I've been working aggressively in Sierra Leone, Nigeria, and other countries to expand to other countries. So it's more like building on the expansion of the project so that we can serve more, in with their unmet needs,
Hmm.
and through our free services.
Oh my God. That's amazing. So, where can people find more information about the Breast Cancer Hub, particularly if they would like to share their treasure and donate to the Breast Cancer Hub?
Of course, everyone is welcome to donate, and that would be really kind of our community if we receive donation, because I'm very bad at asking for that. So if anyone feels from your heart, you can go to Breast Cancer Hub website. It's www.breastcancerhub.org, and you will find there are tabs where it will lead you to the donate button, or breastcancerhub.org. I think it says uh, breastcancerhub.org/donate. If you click
Hmm.
on that, it will take you to the donate page. But I would definitely request everyone to please go to our website. Our the impact that we have had, the programs that we are running, because I don't think I could justify in this time to what the our tireless efforts that we are putting through to serve our so that we can really really push towards early detection and prevention. Another important thing that we are doing also is anti-tobacco campaign, because prevention is another
Yay.
area that we are focusing on, because I have seen lives taken because of the tobacco smoking and also
Absolutely.
chewing tobacco, because the
Yeah.
smokeless tobacco is so prevalent in many countries which are taking innumerable lives. So these are the
Hmm.
different areas that we are also focusing on the preventative measures. But please go through our website. That would be my request, breastcancerhub.org, and scroll through, and if you need any help, you can reach out to me at LOPA at breastcancerhub.org, or there is a contact us section. You can when you drop a message, we will get back to you.
Lopa, thank you so much for your time today. This was
Thank you.
an immensely educational, enlightening, inspiring conversation. And like I said, it's so funny because I feel like conversations that I've been having over the past couple weeks really culminated in this conversation. Like I think it was a little bit of divine happening. So I really appreciate your time and sharing everything. And thank you so much for all the wonderful work that you're doing with the Breast Cancer
Thank you.
Hub.
Thank you, Elise, and the platform that you have given me. And I think I'm in awe of the OncoPT podcast, because
Thank
it's
you.
so essential, and the name itself signifies the power of it, because people will know that the word onco, right, where to reach. So I think I have done many other podcasts, but not specifically as onco podcast. So yours, I love the name OncoPT. So thank you for doing this for us. Thank you for the great initiative, and thank you for giving me the platform. Thank you.
Thank you.